So, how can therapy help when you have an attachment style that is disruptive to your relationships? Well, the first layer of that might be um, getting a little bit more information about what kind of attachment style you have. And this is a little bit more complex than you might realize. If you take one of the online quizzes, you might find that you identify more so with an anxious attachment style. Well, that might generally be true, but in my experience, often different partners, different dating relationships, different coworkers and friends and whatnot can bring out different layers of our attachment styles. And so sometimes we can have an anxious response that actually serves an avoidant purpose and things like that. So understanding more clearly what your attachment style really is, what the different layers and nuances are for your specific attachment style, is very important. And the way that we do that is by talking through history, getting to understand what messages you internalized about relationships, and not judging the past, or again, not judging parents or our caregivers, just trying to objectively understand what would you have internalized about relational dynamics, and how does that impact your relationships in the present tense. It's sort of a data gathering mission, if you will, trying to just ascertain what are the facts that lead to where you are in your current attachment presentation. The other thing about attachment therapy is that the relationship with your therapist can be profoundly important and informative in terms of understanding attachment and the ways that it disrupts connection. It's always important to have a good fit with your therapist, but also a little bit of an asterisk there is that often people will show up, start working with a therapist, and then all of their attachment style issues show up, and they get really anxious. They can't, they don't feel like the therapist likes them, or they think, it's not a good fit for them in some way. Or they get really avoidant and don't really want to explore more, or they don't really want to know more about the layers that they're going to uncover. They don't want to get attached to the therapist. They don't want to feel dependent. So, a really skilled clinician is going to endeavor to help you recognize the ways that your attachment style might even be preventing your ability to show up for therapy.